Pathogenesis of the social anxiety disorder. As we discussed about the specific phobia regarding the pathogenesis, which is primarily focused on the conditioning, the conditioned stimulus. Hence, the better treatment is exposure and response prevention, in the sense you prevent the avoidance, and over a period you give conditioned stimulus repeatedly, and because it is not paired by unconditioned stimulus, the response that will become conditioned will gradually fade, so that becomes extinct. So that is the primary pathogenesis, most important. Other is definitely there in specific phobias when there is misattribution to the level of the threat and the cognitive distortions or the disbeliefs associated with it. But primarily it develops after an experience, and that is where the exposure and extinction becomes important. Now, if we come to social anxiety disorder, here we'll have to understand that the concept of conditioning is not that much involved in the pathogenesis as the cognitive part and the environmental influences play a role. If you see, yes, this we had already discussed regarding when we discussed regarding the dimensional construct, that there are certain temperaments that could lead to possibility of anxiety disorders like behavior inhibition. It is a temperament that leads to withdrawal or withdrawn behavior when exposed to unfamiliar people or situation. And neuroticism is something that is again a trait that leads to negative effect, and both of these traits, a person having both of these traits has higher possibility of developing anxiety disorders. Also, it depends upon the type of parenting, a parenting which is very authoritarian, more importantly a parent who's demanding much, where the child has to be a parent pleaser to get all the approval, validation, emotional validation. If such kind of parenting is there and parent-child interaction is not proper, these people have more vulnerability of developing social anxiety disorder. Obviously, the experiences matter a lot with peers, with other adults, but the important element is this: attentional bias towards threat in the environment, that is regarding self. The person has this bias that I am not worth, I am doing something wrong, that people are seeing me. Though those people might not be seeing, they are even not interested. But this person, the person with social anxiety disorder, perceives in a way that his thought is distorted, that situation, okay, I'm performing wrong and I'm being judged. Maybe I don't have that self-worth. Maybe I'm not that productive or talented, maybe worthless, right? So this attentional bias is a very important element when it comes to the cognitive part of social anxiety disorder. Important to understand here, because in social anxiety disorder, extinction, the therapy of exposure and extinction is not as effective, but cognitive therapy, cognitive appraisal therapy, along with social skill training. Because what happens, because they don't have interaction and they keep on avoiding social interactions and social situations, so they don't get a chance to develop social skills. So when we deal with these two, cognitive appraisal therapy and social skill training, these combination works better in the social anxiety disorder, not the exposure and extinction part. So this is important to understand. This is basically difference in pathogenesis. So we had seen pathogenesis in social anxiety disorder. Prior to that, we had seen in panic disorder.